Hello, my friends. Welcome back to Evergreen Perspective. Once again, I'm Ben Chrisley, and as always, I'm truly grateful that you've chosen to join me today for this podcast. I know you got a ton of things to do, and the fact that you're here really means a lot to me. So, sit back, relax, or if you're driving to work, just take it on and soak it up and enjoy. So today we're going to talk about something that affects every single one of us, every single American out there. We're going to be talking about healthcare. Now, I know that word alone brings up a lot of emotions. You've probably had some experience. Maybe the systems work great for you. Maybe you've always been super stoked with your healthcare or your health insurance, whatever the case may be. But I think for most of us, we've been hit in some way or another. Maybe you had hit with a medical bill that left you how on earth you were supposed to pay for it and make sense of it. So no matter where you stand, I want this conversation to be a space where we can break things down, look at the facts, but most importantly, we always want to be able to listen to each other and listen to new ideas and new perspectives and try to keep an open mind so that we can help come up with real solutions that can help everyday Americans. Because at the end of the day, we all want the same thing, right? We all want to be healthy. We want to take care of the people we love. And, we want to be there for those people that need us. So the big question is, what's the best way to make this happen with healthcare? And to get us started, I want to take a moment to talk about what are we actually paying for in healthcare in this country right now? Because for most of us, healthcare isn't just about getting the service, but it's about the bills that show up in the mail. It's about how we feel. It's about the decisions that we have to make on, hey, can I afford this procedure, or can I afford this medication, or do I have to go without? Can I pay my rent, or do I have to buy this medication? So those are decisions everyday Americans are making. Can they afford the healthcare, or do they have to eat and have a roof over their head? I think we all know which one we end up choosing, because we don't want to live in the streets. So I'd like to take a look and tell you a little story. We're going to talk about Sarah. We're going to bring Sarah up a couple times throughout this podcast, and we're going to talk about what her healthcare might look like under different options. So Sarah's a 32-year-old freelance graphic designer, and let's take a look and see what happens when she falls through the cracks with no insurance. The harsh reality of being uninsured is a very difficult place. Sarah had always been independent. She built her own career. She took on contract work, and she made a decent living. But because she worked for herself, she had no employer-provided health insurance. She earned too much money to qualify for subsidies under the ACA, but not enough to afford a comprehensive private plan out of her pocket. So that's a very difficult situation a lot of Americans find themselves in. So Sarah, she developed a persistent cough, and at first she brushed it off as maybe some seasonal allergies, but, not having insurance, she wasn't going to go see a doctor. So as the weeks passed and the cough worsened, started turning into some sharp chest pains in the chest. She started having some severe fatigue, and her friends urged her to go to the doctor, but she hesitated because without insurance, a simple checkup could cost her hundreds of dollars. If she had to go to the emergency room, that could cost her thousands of dollars. So she kept working through the pain, hoping it would go away. Then one evening, she collapsed in her apartment. Her friends got worried about her, and so they came over and checked on her, and they found her unconscious in the bathroom. So they had to call 911. So Sarah wakes up in the hospital. The news that she had severe pneumonia and that she had a partially collapsed lung, and she was on the verge of being septic. So the delay in seeking care meant the infection had spread, right? So she had required intensive treatment, a week-long stay in the hospital, part of that in the ICU, and then she had follow-up care after that. So the hospital obviously was required to treat her by law because they have to. The hospital knew full well she wasn't going to be able to pay. But, they're going to take care of her anyway. The hospital administrators, though, they want that money. So when she's finally discharged, she was left with a bill of over $35,000, right? An amount that wiped out any amount of money that she had. and it forced her to take on this crushing medical debt. So, unable to work, she fell behind on rent and she lost her apartment. The system didn't fail her, it actively deeper pushed her into financial ruin. And the sad part is that her illness was completely treatable with early interventions. Just because she was uninsured, she hesitated to seek care. And like so many others, Sarah paid a much higher price in the end. Many left uninsured end up paying with their life. So I guess in some aspects, she was lucky only to end up in crippling medical debt. So what are we actually paying for it, right? If you get your healthcare insurance through your employer, right now the average is about $111 a month for individual, but it's over $500 a month for a family plan, because your employer ends up covering a big chunk of that. So if you're lucky enough to have employer assisted health insurance, hey, that's awesome. But all in, when you add up what's being paid on both ends, the total price is rather large. So it goes about $8,500 a year for individual and almost $24,000 a year for family. If that's the total, so the parts you pay in and then the parts your employer pays in. So that's a rather large amount. If you're getting your health care through the ACA marketplace, the cost can vary widely depending on your income. So the good news is that subsidies exist to help keep premiums more affordable, but the catch is you have to qualify. So as we learned in Sarah's case, she made slightly too much money to qualify. And so as it sets right now in 2025, individuals earning between about 15 to 60,000, and then a family of four earning about 32 to 124,000 can get financial assistance to lower their premiums. For those in this range, the Affordable Care Act is designed to ensure that they don't pay more than about 8.5% of their total income in health insurance. But if you make just a little bit too much, that assistance disappears fast, right? That leaves many middle-class Americans stuck paying full price. So if they can afford to pay it all. So, while it was ACH started as a good thing to help citizens afford health care, it probably should have been called more something like marginally affordable health insurance that probably doesn't actually get you the actual health care insurance you need act. That may have been a better name for it. I'm not totally knocking the ACA. It definitely had some good intentions up front, but once it reached the floor, it was chopped up, and some options that would have moved our health insurance forward quite a long ways got axed. So while it does help many Americans, there's still a huge gap of people who earn too much to get assistance, but not enough to comfortably afford coverage themselves. It's a system that basically leaves millions and millions in a tough spot, paying thousands for coverage they can barely use because of high deductibles and out-of-pocket costs. I think it's no wonder when we start looking at the overall birth rate in the United States right now has been on significant decline. It's because providing the care for a family is getting out of reach for the average hardworking American, especially for those that are self-employed or own small businesses. Those who don't get insurance through their employer, coverage can be a huge, massive financial burden on them. So those without an employer and they make too much for the Affordable Care Act, that burden falls directly on them. There's no assistance for those hardworking Americans. So for small business owners, entrepreneurs, these high costs can be massive barriers and making it harder to take risks, to invest in growth, or even start new businesses in the first place. It stifles innovation. When health insurance costs as much as a second mortgage, how many great ideas never get off the ground simply because people can't afford it? How many small businesses struggle providing health care for employees because it's just simply too expensive? As a small business owner myself, I wasn't able to provide employer-assisted insurance because it was simply too expensive for me. I would not have been able to stay in operation while doing that. I looked at it several times from several different angles, and anything that was affordable for myself and my employees, ended up being a colossal waste of money because it actually didn't cover much of anything. So this isn't just a person. Healthcare just isn't a personal issue. It's an economic one for all of us, for each and every one of us. The high cost of private insurance doesn't just affect individuals. As I mentioned, it stifles innovation, entrepreneurship, and the ability for people to create something new without the fear of losing access to their healthcare. So, I mean, what are we even doing? But even after you pay for all that, after all the price we just talked about, that's not the whole picture either. Because even after you pay for all those premiums that we just discussed, then they start tacking on deductibles and co-pays and other out-of-pocket expenses. The average American with private insurance is spending between $1,500 to $2,500 a year just to cover what their insurance doesn't. And that's just the average. That doesn't include folks that have chronic health conditions, right? Or any other problems that may arise that are above and beyond what their insurance deemed that they should be paying. So in reality, we end up paying much, much more, right? So even if you're paying for health insurance. So let's talk a little bit now about Medicare, right? So what are we paying into Medicare? So we've already established that for millions and millions of Americans, we're paying into health insurance from at our job, and then they're getting supplemented by their employer, or they're getting it from the ACA, or they're just pulling out of pocket for large premiums all on their own, right? So on top of that, every paycheck is 1.45% of your income goes towards Medicare. And if you're self-employed, that jumps up because you have to pay both sides, right? So 2.9% jumps up. So you're the employer and the employee. So if you have a job and your employer is helping you with health insurance, they're also paying the other percentage piece of that Medicare. So even more money is going into healthcare. So unlike Social Security, there's no income cap on Medicare taxes, meaning whether you make $50,000 or $5 million, every earned dollar is taxed for Medicare. However, there's an extra layer for the higher earners, right? So if you make more than $200K as an individual or $250,000 as a married couple, you get the luxury of paying 0.9% Medicare surtax on any income level above that threshold. So that means that those with very high incomes, they do end up contributing more to Medicare. But for the majority of America, as we know, we make nowhere near that. The base is 1.45% deducted every paycheck all year long, every year, year after year. And then once you hit 65 and enroll, guess what? You're not done paying, right? Because the system and policy set up, paid for by big insurance lobbyists to line the pockets of the appropriate people that can pass these items through. Our elderly, our most vulnerable, who are on fixed incomes already, they're likely paying another $175 a month for some Part B premium or supplemental, right? That cost increases if you opt for additional coverage like Medicare Advantage or supplemental plans. So while everyone contributes to Medicare their entire working lives, many retirees still face significant healthcare costs when we actually need healthcare the most, right? Leaving older Americans on a fixed income struggling to come up with the money to live and take care of their health, right? This only further leads to decline in their health, in turn costing healthcare dollars to individuals and taxpayers a lot more than it should have. So where's all this money going, right? Last year, Americans spent about $1.2 trillion on private health and premiums, right? At the same time, Medicare spending totaled almost $1 trillion all on its own. So much of which wasn't actually spent by the government, but paid out to major insurance companies that manage Medicare Advantage plans. But here's something we don't always talk about too, right? Insurance companies aren't just collecting premiums, they're also making massive profits, right? In 2022 alone, the five largest health insurance companies made about $48 billion in profits. That's billion with a B. I think it's most important to stop and emphasize the magnitude difference from millions to billions. I might say this every podcast, I don't know, because I just want to remind everybody that there's a far bit of difference between being having a million and having a billion, between being a millionaire and being a billionaire. All right, so let's remember that 1 billion is 1,000 millions. Okay? All right, let's take a little break here on that. I'd like to introduce Kate. She's going to come in and give us Kate's Civic Corner. She's going to let us know different happenings that are in and around the 3rd Congressional District, different ways you can get out and engage with the community. And just she'll give you some ideas if you're not listening to this pod from the 3rd Congressional District. She'll give you some ways that you can go out and seek in your own area, in your own region, how you can get involved with some civic engagements as well.
Thanks, Ben. Hey folks, Kate here with the Civic Corner, taking a couple minutes to highlight some opportunities to get involved in Southwest Washington. There are innumerable events nationwide though, so if you're not in the area, get on the web and see what you can find in your area. As always, we'll put the link to each of these events in the show notes to give more information regarding what to expect and how to sign up. On March 20th at 6 p.m., Stevenson has their city council meeting. You can attend this in person or stream it live on YouTube. On March 24th at 7 p.m., Washougal has their city council meeting. On March 26th at 7 p.m., the 20th Legislative District Democrats will be holding their meeting virtually. And for volunteer opportunities, the Woodland Action Center is looking for help with their food bank and thrift store. Check out the link in the show notes for the various ways to help. If there's an event in Southwest Washington that you'd like us to feature here on Evergreen Perspective, please drop it in the show notes or shoot us an email. This is Kate with Kate's Civic Corner, encouraging you to get out and get involved. Now back to Ben.
All right, so what we're talking about here is where does the money come from, right? It's not just premiums, right? Their profits aren't just coming from premiums. How do they make profits, you might ask? Let's think about that. Oh, I know. They're denying claims. They're denying care for people who are paying for their insurance, right? Nearly 50 million medical claims alone last year from insurance companies that are represented on the ACA, right? And I should also note, right, the ACA is not some government insurance, right? The ACA is just a place that people can go to. It's just like think of it as a warehouse where you go and you pick out what you want to purchase for insurance. Companies like Blue Cross, Aetna, Cigna, etc. all have stuff on the ACA, and then they're getting supplemented by the government for this insurance. So this is the reality. We're spending trillions and trillions of dollars, yet millions of people are still underinsured or not insured at all, right? They're either uninsured or uninsured. So families are going into debt just to pay for medical care, and insurance companies, they're turning record profits. While I know most of us are pro-capitalism, right? Should healthcare be available only to those who can afford it, right? Or should healthcare be a basic human right that every single American should have regardless of how much money you make? All right? Stop buying into the propaganda and ask yourself, who benefits the most from staying in our current system, right? If you're not sure, I'll give you a hint. It's not the American people. The American people are not benefiting the most by staying in our current health insurance system, right? We're the richest, most powerful country in the world. Some might argue currently in the history of the world ever, right? Here we are in America with millions of Americans without basic health coverage, right? And millions more that are severely underinsured should a major medical event actually happen, right? The health insurance industry invests substantial resources in lobbying and giving political contributions to influence policy decisions, right? You want to know if the people you're voting for are getting money from insurance packs. It can sometimes be hard to track down, right? Because we know that there's a lot of dark money that goes into campaigning, and there's no way to really, really track down who's giving that money. But if you look how some of these politicians are voting to stamp down our ability to expand healthcare for Americans, I think you'll find which pockets that it went in, right? Companies like Blue Cross, Blue Shield, Cigna, United Health, Aflac, right? In 2023, the whole insurance sector as a whole spent over $157 million just in lobbying activities, right? That ranks third among all industries in lobbying expenditures. They spent another 60 million just on political contributions, right? These substantial investments underscore the healthcare industry commitment to shaping healthcare policy and regulations in the US, right? These efforts are aimed at shaping policies that protect and enhance profitability and limit regulatory constraints on the insurance industry, right? They're doing it to maintain their own market advantages, right? I mean, Big Pharma has fought tooth and nail to stop Medicare from negotiating drug prices, arguing that it would stifle innovation, right? The current administration just signed in to make insulin go way back up again, right? We thought we'd had a victory there. I mean, insulin isn't a luxury drug, right? It's a life-saving drug that millions of Americans count on, and it needs to be affordable, right? In reality, countries with universal health care, they negotiate their drug prices all the time. Their citizens pay half of what we do for the same medications, right? Like, remember, we were talking earlier about the Affordable Care Act, right? The original ACA legislation, it included a public option, right? A government-run health insurance plan that would be able to compete with private insurance, right? It wasn't trying to take over and knock out private insurance. It was just trying to give an option that Americans could pay into, and it wasn't even going to be free. You would still have to pay for it, but it's going to be an option that would make private insurance be held more accountable, right? The idea was to provide affordable alternatives, particularly in areas where private insurance options were limited or too expensive, right? The version that passed was heavily influenced by this lobbying effort we just talked about. Removing ideas like a public option and preserving private insurance dominance, right? The same goes for efforts to expand Medicare, right? Insurers push back hard because it threatens their bottom line, right? Their profits, their billion-dollar profits, right? Man, it's so frustrating. Like, what would we have done what do we got to do to get them to step up to take care of everyday Americans, right? To get the insurance companies back in line, right? Well, when the ACA came around, they found their stooge, right? Senator Joe Lieberman, right? He rallied so hard not to have the public option, right? He was bought and paid for. We all know it. And if you don't believe it, you can go Google it yourself, right? Follow the money, right? If you support candidates, like I said, find out where they're getting their money from. See if their values align with your values, right? Stop listening to just what they tell you and do your own research, right? Get it from different sources, right? We always talk about we want term limits for Congress. Term limits is your vote, right? You don't like what's happening in Congress, vote for somebody else, right? We continue to do the same thing and get the same results. And I think that's the definition of insanity, right? We got to do better. We got to pay attention harder, right? Ever wonder why drug approval laws seem to favor pharmaceutical companies? Well, the industry lobbied for faster FDA approvals, which reduces safety requirements in some cases, right? Meanwhile, insurance companies spend millions to limit regulations on pharmacy benefit managers, the middleman who drive up prices. Now, here's the big question. Is this the best way to do it? I mean, if we could build a system, if we could start a system and build it from scratch, and we sat down at a round table with the brightest minds in our country, is this the way we would design our system? Or would we design some better way, one that makes sure that everyone gets care without breaking the bank, and one that doesn't leave anybody behind because it doesn't focus on how much money you make, but rather treating healthcare as a basic human right, right? That's what we're here to discuss today and to think about, right? Today, I want to explore many sides of the debate. We'll look at the case for keeping private insurance. We'll look for a case for some universal care, and maybe whether there's some middle ground in between that we can look at that can maybe be a bridge to something better. So settle in, right? We still got a lot more to unpack. It's a big topic, and we're only really scratching the surface today when it comes down to it. We'll do more coverage on more in-depth stuff on other pods coming up in the future. So if you have some questions that we haven't hit on by the time we get done with this podcast and you'd like to see more information or an expansion on something, you can feel free to email me your questions, or you can drop it in the comments below this podcast. All right. So I appreciate you guys being here and being supportive and listening and keeping ourselves open to new ideas and directions, right? So, what did supporters of private insurance argue makes it worth the cost? All right, and what might universal health care offer as an alternative? Okay, before we dive into potential solutions, let's take a hard look at where the U.S. healthcare system stands today, its strengths, its shortcomings, and the reality millions of Americans face when trying to access that care, right? The United States spends more on healthcare than any other nation in the world. This is not the flex we want it to be, right? This is definitely not a case where more equals better, right? In 2023, total healthcare spending in the United States of America reached 4.5 trillion. That's trillion with a T, right? Which breaks down to approximately $14,000 per person. That's nearly double what other developed nations like Germany, Canada, and the UK spend, right? Which hover around $6,000 to $7,000 per capita. We're at 14,000 per capita, and they're at 7,000 per capita, right? So to put that in perspective, healthcare spending accounts for nearly 18% of our GDP, right? That's almost a fifth of the entire U.S. economy, right? But despite this massive spending, Americans aren't getting the best care outcomes for their money. The reality is our system has major flaws that impact affordability and access and health results, okay? So, let's outline some challenges, that we face on a daily basis, right? Access to coverage is a big one, right? While employer-based insurance covers around 153 million Americans, about 26 million more plus people remain uninsured altogether, right? I imagine that number's probably higher than that, to be honest. I think some of these numbers are often hard to calculate or capture. But many of them fall into that frustrating coverage gap we talked about earlier, right? They make too much to qualify for Medicaid, but they can't afford private insurance, right? And then if they make too much, they don't get the break on the Affordable Care Act place, right? So if you're self-employed or buying insurance through that marketplace, you're paying a significant amount, probably around $500 per month for an individual plan, or maybe over $1,200 for a family plan. And that's before all the other costs we already talked about, co-pays and deductibles and out-of-pocket costs that they just don't cover. For small business owners, this burden makes hiring employees and expanding businesses significantly harder, right? And then once you slide into, the rural areas, right, they face severe doctor and hospital shortages. They're just not healthcare there to access. There's nobody there. There's no providers there, right? We've beat down the healthcare system so much that it becomes nearly impossible for healthcare providers to go to rural communities and make a sustainable living to be able to assist in those communities. So, the true cost of healthcare is, even for those with insurance, the financial strain is undeniable, right? What we're paying is out of control, right? We know that it's $8,500 a year total for singles, or over $16,000 to $24,000 annually for family plans of total cost, right? And then we know that Americans are spending additional money for deductibles, co-pays, and services that insurances just don't provide. And that's just average healthy individuals that just need it for, basic care and checkups. That's not even getting into those that have chronic medical issues or medical emergencies, right? I mean, maybe you don't have to imagine that. Maybe you're one of the millions of Americans that have chronic medical issues. So I'm sure you know firsthand how expensive it can be and how difficult it is to navigate the healthcare system, and how difficult, they seem to make it sometimes just to get the coverage that you're paying for, and you have to fight to get the coverage to pay for what you're paying for. It's ridiculous, right? On top of that, workers continue to contribute their entire life, every paycheck that 1.45%, or if you're self-employed, or it's 2.9, right? We know that. That adds up to thousands a year for households, okay? So while Americans struggle with cost, the top 7 insurance companies made over $7 billion in profits in 2023. Right? And that counts for denials too, right? So we're talking about a lot of that profit, as we talked on before, isn't just about premiums, right? It's about denials of care. That's how they are making all those profits, right? They got restrictive cover policies, and they do their best. The actuaries sit at their desk and look at somebody's medical chart and decides that that person doesn't need that medical treatment. Who are they to decide that? That's between the doctor and the patient. And if that physician doesn't know best, then what are we even doing in America? We're not trusting our providers to do the right thing by their patients? That's ridiculous, but that's what the healthcare insurance companies get away with every day, year after year, right? 2022 survey found that over 41% of adults carry medical debt. That's 1 in 4 Americans. One in 4 Americans also skip medical care due to cost. Think about that. Millions of people every day are making the choice between their health and their financial survival. This should not be happening in the United States of America. I don't know about you, but I don't like paying more for less, especially when it comes to healthcare, right? So for all that spending, are Americans healthier? Not really, right? Our life expectancy in America is about 77 years currently, several years shorter than other countries like Japan, which is 84 years, or Sweden, which is 83. We like to think that USA is number one in all things. Well, I can assure you, we are not number one in healthcare unless we're talking about the amount spent for some of the worst care in the world, right? The U.S. has the highest rate of chronic diseases such as diabetes, heart disease, and obesity among developed nations, right? The U.S. ranks dead last among high-income nations in deaths that could have been avoided with better healthcare access. So if they would have had better healthcare access from birth to where they're at, they would have never been so sick to start with. We wouldn't be having these high rate of mortality like we do, right? Currently, we rank dead last in preventable deaths in the world in industrialized first world nations, right? But let's talk about, right, as most things, it's not all doom and gloom. We do some things well. We do a lot of things well, right? Don't let me paint that total picture, right? We have some remarkable things that we do in the U.S. healthcare system, right? The medical innovation and research, the U.S. leads in new drug development, cutting-edge treatments, and medical technologies, right? So we're doing a ton in that sphere, which is awesome. We got some of the best hospitals absolutely in the world, like the Mayo Clinic, Johns Hopkins, or like the one of the ones I worked for, the Cleveland Clinic. They're in the U.S., right? Rapid access for those that can pay, right? Unlike many universal systems, those with top-tier private insurance and a big bank account can often get faster access to specialized care, right? Although the question you have to ask yourself there is, just because you have more money or better insurance, should you get front-of-the-line privileges and special treatment? Is that the way that should be, right? For the average American, that type of expediency, those benefits are out of reach, right? Either due to cost, lack of coverage, or just general system inefficiencies, right? So where do we go from here? Like, where does this leave us? We have a system that is technologically advanced, but financially crushing for millions of Americans. A system that rewards profits over patience and bureaucracy over efficiency. We know other nations spend far less, yet deliver better outcomes. That's a fact. That's proven. So the big question is, what can we learn from them, right? What can we learn from them? We don't have to reinvent the wheel here, right? What would actually work in America, right? That's what we're working on exploring here. That's what we're talking about. Let's explore the arguments for keeping our private healthcare insurance, right? Supporters of this approach highlight 4 key benefits. So 4 key benefits that are cited for the reason we should go ahead and keep our system just the way it is, right? So a lot of people think that supporters argue that private healthcare gives individuals the freedom to choose plans, providers, and treatments that align with their specific needs, right? So if you want to access a particular doctor, hospital, or specialized care, they say that private insurance allows you to do that if you can pay for those options, right? It's a great flexibility to have. right? I think it's amazing. And once again, it comes down to, is your insurance good enough and can you afford it, right? So, in that example, you could get to any specialist you want it, right? And that's good, right? And Americans, we value the ability to customize our care and have choices, right? They also say competition between private insurance, hospitals, and pharmaceuticals, right? That old saying that competition will drive down cost, right? Will keep the market in check. That typically hasn't been really that true in hospitals because insurance companies contract with certain hospital systems and then they dictate the prices from there. And other insurance companies aren't always welcome in those facilities, right? But they say that competition incentivizes constant innovation, especially within pharmaceutical companies, right? According to Forbes, the U.S. leads the world in pharmaceutical advancements, right? Accounting for nearly 45% of drug developments globally. But once again, I'd be remiss not to interject here that the United States leads the world in pharmaceutical spending as well, right? With per capita expenditures are significantly higher than those in other developed nations. So we're spending way more on our pharmaceuticals, right? And this trend has been consistent over time, right? The crazy part about that is that it's not because we are paying, it's not because we are using more pharmaceuticals than these other countries, right? That's not the reason. That's not the reason it's so much higher, right? It's because we are paying so much more, right? The rub is that spending is primarily due to higher drug prices in the US compared to the rest of the world, because the rest of the world is negotiating their pharmacy prices, right? While we just are at the, we don't have that. We're not doing it. We're not putting caps on it, right? We're taking caps off of drugs like insulin, and we're not making them more affordable. We're spending more money and having worse outcomes, right? But let's get back to some positives of the current system. Let me not get too down on it, right? Let's try to present both sides here. Cutting edge treatments are developed in our current system, right? But who's to say cutting edge treatments wouldn't be developed in a system that also supported all Americans? Why wouldn't they continue to be innovative? I'm not sure. I'm not sure where that comes from, right? But anyway, proponents also highlight the private systems often deliver faster care, like we talked about. But really, that's for those who can afford it. They can avoid wait times for specialist or elective surgeries, or get advanced treatments, maybe that aren't covered under insurance because they can afford to just pay for it out of their pocket. I don't know about you, but I sure wouldn't be able to afford to pay for some experimental treatment out of my pocket. I don't know. I guess if you're really wealthy, you don't care. Hip replacement candidate, for example, in a single payer system, it can take a couple months to get in for that hip replacement, right? Whereas in the U.S., you can oftentimes get in faster. But we're getting in a couple weeks earlier for that hip. Is that worth all the extra money that we spend in order to get there? I don't know. What do you think? It's a great question. You know, Critics of universal care always argue that a government-run system can lead to bureaucratic delays, right? They worry about care being rationed, where limited resources mean some treatments are delayed or unavailable. If we went to universal healthcare, where does everybody think all the doctors and hospitals and specialists are going to go? They're not going anywhere. They're not going to disappear, right? I get it. Healthcare is about choice. We like it, right? The ability to decide who treats you and how. And that's great in theory, right? And so the fear of the one-size-fit-all approach, we fear is going to strip away our flexibility, right? And as Americans, we like options and we like that flexibility. And I get that. However, I got to ask, why wouldn't we have the same options and flexibility if every single hospital and every single doctor and every single pharmacy all took our healthcare plan, right? It wouldn't be like Medicare at that point, because Medicare, is not accepted everywhere for all the things. Not everybody has to. They can say, we're not going to, and then they don't get any federal financial assistance, and they don't need it because they're specialists and they're getting paid cash out of pocket, right? Who's to say that would change in a and a more universal one-payer system. You know, so let's take a moment to get back to a little bit of story. Let's go back to Sarah. All right, let's check in with Sarah and see what would have happened. Right, we remember that she got sick before, didn't seek care because she didn't have coverage, and it ended up costing her, being in medical debt because of that. But let's see what would have happened if she'd purchased a private health insurance that she could afford. Say she got it through the ACA or whatever, right? So this time she was more prepared. Sarah was, right? After years of going without insurance, she finally bit the bullet and purchased a high-deductible catastrophic coverage plan from the ACA. It cost her about $380 a month. It was a steep expense for a freelancer, but, at least she had something, she thought. I got some insurance just in case something happens. So when the cough started this time, she checked her plan. A doctor's visit was going to cost her about $150 out of pocket, plus about $60 for some basic tests. Not great, but manageable. She scheduled an appointment. The doctors diagnosed her with bronchitis and prescribed her some antibiotics. The medication was $90 out of pocket because she hadn't hit her $8,000 deductible yet. She hesitated, but she paid for the prescription. And for the moment, it seemed like the system had worked well for her. She got the care, she got the medicine, and she went home. But 2 weeks later, she wasn't improving. The antibiotics, they weren't working on her breathing. Became more labored. So she called her doctor, who suggested a chest x-ray to rule out pneumonia. So that's when she kind of hit a wall here, right? The x-ray is going to cost about $700, and her plan wouldn't cover it because, once again, she didn't meet that high deductible. So she had a tough decision to make, She couldn't afford more medical bills, and she told herself she'd just ride it out, right? She's ride it out. But days later, she woke up gasping for air, and her friend ended up having to rush her to the emergency room, where she was diagnosed with severe pneumonia, and her lungs were filling up with fluid. So her one night in the hospital cost about $9,000. And now she's responsible for most of that, right? Because her deductible was $8,000, right? She had insurance, but when she needed it most, it didn't really protect her from that potential financial hardship. It eased the burden off, right? It was better than no insurance, right? Sometimes something is better than nothing, but couldn't it be a lot better? So now let's consider the argument for a universal healthcare system, right? A model where everyone has access to care regardless of income or employment, right? Access for all supporters of universal healthcare believe that healthcare is a fundamental human right. That makes sense to me, right? It shouldn't be a privilege tied to employment or wealth. In a vast majority of developed high-income countries, universal healthcare is already a reality, right? According to the Organization for Economic Cooperation and Development and the WHO, not the band, but the World Health Organization, at least 38 developed nations provide universal healthcare in some form. 38 developed nations provide universal healthcare in some form. Countries like the UK, Germany, France, Sweden, Finland, Belgium, Greece, Ireland, Japan. I mean, the list goes on and on, right? Argentina, Cuba, United Arab Emirates, right? A lot of places, right? Each system does vary, and some, like the UK's, are fully public, while others, like Germany and Switzerland, use a regulated private insurance model where the government ensures affordability and universal care. So they work together, hand in glove, right? And then there's the United States. The only highly developed nation without a system that guarantees healthcare to all citizens. Instead, we rely on some patchwork of employer-sponsored insurance, Medicare, Medicaid, private plans, which leaves millions of people falling through the cracks. Could you imagine never having to worry about copays, deductibles, and medical bankruptcies? Advocates say this system prioritizes health over profit. And shouldn't we? In this particular instance, in our society, shouldn't we be prioritizing people over profits? When are we going to wake up? One of the largest arguments for universal health care is that it's actually cheaper. Right? We already know the U.S. spends about $14,000 per person annually on healthcare, more than double countries like Canada, Germany, Australia, where I talked about this, where they spend like 6 to 7 thousand per person, right? Despite that massive difference, the care people receive in those countries is often better, not worse, right? Their care is better. So where's all the extra money going? A big part of it is to administrative overhead. The costs associated with running multiple private insurance companies, marketing plans, negotiating different provider rates, and processing complex claims, that takes a lot of people. That takes a lot of money, right? And then you got the big bonuses you got to kick to the executives, right? And CEOs. And then you got to make sure the shareholders are getting their cut, right? Why are we publicly trading health insurance, right? That's like, we're basically publicly trading people, aren't we? Right? Basically publicly trading American citizens on the stock market. That's basically what we're doing, right? Private insurance companies in the U.S. spend 12 to 15% of every dollar on administrative costs, executive salaries, and profits, right? Well, Medicare, by contrast, is only about a 2% overhead. I mean, I think business-wise, that seems to make sense right there, right? 12 to 15% overhead or 2% overhead, right? And maybe if we went to some system where it's universal, we'd have to have a little more overhead because we would have to have some more people working there. But designing a system from the ground up, as we might have the opportunity to do, couldn't we leverage today's modern technology to streamline what those processing and the payment system might look like? I think we could. I think we have some of the brightest minds in the world right here in the United States that are doing some amazing, amazing things with technology, right? We have the proliferation of AI that's doing things and growing every day, right? So I think there's a lot of room there to do something, right? Countries with universal health care, they don't have the same bloated system of insurance intermediaries, right? They don't have the middleman or woman taking, the middle person taking out their cut, right? Instead, they operate a single streamlined system where costs are negotiated upfront and everyone pays far less as a result, right? And as we know already, here's the kicker. Paying more doesn't equate to getting better health care, right? The U.S. ranks far behind in many of the key indicators, right? We've already talked about it. Life expectancy, right? We have years behind others. And here's one that really always strikes me, and this has been going on for a long time. And I think this should, especially with the decline in the birth rate, I think everybody should look at this and think about it. The U.S. has the highest infant mortality rate among developed nations. Babies born in countries with universal health care have a higher chance of surviving their first year than if you're born right here in the United States. That's unbelievable to me. That puts me to the floor. That makes no sense, right? Can you agree that in America, we shouldn't have a higher infant mortality rate than the rest of the world? I think we can. I think we can do better, right? The U.S. ranks last among high-income nations in deaths that could have been prevented. We already talked about that, right? Dead last, right? Countries with universal health care consistently see better health outcomes because people aren't afraid to go to the doctor, right? They get routine early screenings, preventative care, right? That reduces serious interventions that may have to come along later, serious medical crises that might develop, right? In doing this, it ultimately lowers the overall cost of healthcare. So when you look at how much we've spent on healthcare and the money we're paying into it, you can already see how it would be less than even the projected number is, right? Not having financial barriers to care in the universal system, no one has to choose between seeing a doctor and paying their rent, right? They can do both. Right? In the U.S., millions skip doctor's visits and delay necessary medications or put off treatments because they simply can't afford it. Right? This only leads to worse and far more expensive health issues down the road. Right? Preventive care isn't just good for public health, it's good for society as a whole. It's good for economics. Right? And that's something we can all get behind, right? Everybody wants to get behind. We like the money. So if it can save a lot of money and actually put more money into the economy by having better health, isn't that a win-win, right? Catching illnesses early saves lives, saves money, right? And yet, in our system as it currently sits, medical debt remains the leading cause of bankruptcy in the United States, right? Leading cause of bankruptcy is medical debt, right? Meanwhile, in countries with universal health care, everyone gets care when they need it, without the stress Surprise bills, insurance denials, or going into financial ruin because you got sick. We don't plan on having sick or a major medical issue. We don't plan on, having a motorcycle accident, a car accident, a trip and fall, being a result of some, street violence. We don't plan any of those things, right? But those things can ruin lives, right? Right. And it turns out that most people in the country, in the U.S. right now, they support a universal system, right? A recent poll found that 70% of Americans believe the government should ensure health care coverage for all. 70%, right? 62% of Americans think it's the federal government's responsibility to provide health care. So why haven't we gotten anything done? It probably has something to do with the amount of big pharma and insurance companies dumping money into the pockets of those that have the ability to make the decisions to put up proper legislation that would allow us to move forward in our healthcare in America. Right? Who are we voting for? What are they doing for us? Right? However, Americans are divided, which doesn't surprise me, on how we should do it. Right? With 46% preferring a government-run system and 49% wanting a mix of private and public options. So the real debate isn't about whether we should provide health care to all. It's how we should go about doing it, right? Should we expand Medicare? Should we adopt a hybrid system like Germany? Should we phase in universal coverage gradually? These are real questions that need real answers and real action. Right here in Washington State, there's a legislator that's in committee. There's a significant push towards the universal health care bill. There's 2 companion bills on that are out there now, collectively known as the Washington Health Trust, where the aim is transforming healthcare access for all residents right here in Washington State. Right? The vision behind the bills, the Washington Health Trust, proposes a comprehensive healthcare model that guarantees coverage for every resident. Right? This includes primary care, dental, vision, prescription drug benefits. The goal is to create a fair, accountable, cost-effective system that eliminates barriers many face in accessing essential healthcare services every day, right? While the bill outlines structure and benefits of the proposed system, they intentionally left out the specific mechanisms to fund it. They want that to be determined by a full legislation body, right? They all want to be able to talk about it to figure out the best way to do it, right? This encourages that there's collaboration across the aisle from all individuals, right? The potential funding sources could come from payroll taxes, potentially income taxes, or other state revenues. But these details remain under discussion, right? And I know what you're thinking. Oh, more taxes. We're already taxed to death here in Washington State. I agree. We are taxed. We got a ton of taxes. But if you could take your payroll, subtract that money you're paying for health insurance now, right? Subtract the other things you pay, co-pays, out-of-pocket expenses, and alike, and take those out. And then how much money is that? So you could pay a little more tax. It'd be less than what you're already paying right now, potentially. I don't know. We haven't worked out the numbers. We don't know them yet, but I think there's potential there, right? Every Washington resident stands to gain from the Washington Health Trust, right? By ensuring universal coverage, it will take away the health disparity between income gaps, right? Narrowing the health gap, right? I can see in our capitalist society, we got a lot of money up top, not a lot of money at the bottom, and those at top get great care and they live longer lives, and that's just a proven fact, right? So those who don't have as much money, they don't live as long, right? So we're basically saying, hey, their lives don't matter as much. That's what we're basically saying. So, it provides that care regardless of your economic status, right? A significant feature of the proposed system is the elimination of cost sharing, right? So this would mean many residents wouldn't face those out-of-pocket expenses like the co-pays, deductibles for coverage service, right? So as we talked about, you subtract that out, what you're paying, and then maybe the little bit of tax increase is tolerable, right? The intent is to fund the whole system through public financing, right? Rather than putting more financial burden on the individual, right? So despite the promise of these bills, obviously there's a lot of hurdles that need to be overcome. They're in committee right now. And these committees will review these bills and debate them. They'll have public hearings and decide whether to advance them to the full floor for the debate. Political opposition, budgetary restraints, obviously differing opinions, and probably differing opinions of who's paying for their campaigns as well will affect this legislation. And if you're an insurance company that operates in and around Washington State, I'm sure you have a lot of reason to put money in the hands of those individuals that might say, hey, we don't want to do this for whatever reason. So, as Washington State navigates this legislation journey, the outcome could set precedents, though, for universal healthcare initiatives across the nation, right? Maybe that's how it starts. Maybe it starts with a state's initiative, and we get there as a country, slowly but surely. Time will see. We'll see how it plays out. But, let's take a look at Sarah. Sarah, so we've seen Sarah in action with no health insurance. We've seen her in action with comprehensive, colossal insurance that has high deductibles. Let's see what her world would have looked like in a universal healthcare system. So that brings us to Sarah, right? What if she'd had universal healthcare? Let's see how that might have played out, right? In a world where universal healthcare is a reality, Sarah's story, could look very different, right? The moment she started feeling sick, she scheduled an appointment with her doctor without hesitation. She didn't think about the cost, right? There's no cost barrier there, nothing, no deductible to worry about. She went, made an appointment, went and saw her provider. She received a full checkup, x-ray, lab test to confirm her diagnosis of early stage pneumonia. The doctor was able to prescribe her antibiotics and schedule a follow-up visit a week later to monitor the progress to make sure that she was actually getting better. And all that was fully covered. All right, the entire process from the first appointment to the final recovery cost Sarah nothing out of pocket. Right? She never had to choose between her health and her bank account. Right? She was back to work in a week, fully recovered without any financial stress, without any medical debt, and without the risk of her conditioning spiraling out of control, becoming life-threatening, and sent her to the emergency room. She didn't have to worry about that. For Sarah, healthcare wasn't a privilege. It was a right. And while it may sound like a fairy tale, this is how it could actually work. And it does work every day like that, all over the world. All over the world for these first world nations. So it can be done. It can be done. So the bottom line is other developed nations have figured out how to do it, right? They figured out how to spend far less money and provide better care. They live longer, happier, healthier lives. No one in those countries are going broke or bankrupt because they got a hospital bill. So, why can't we, right? I think we should be able to agree on that, right? No one should have to choose between going to a doctor for their health or a major medical condition or paying their rent, right? So my thought is, what if there's a way we could combine the best of both worlds, right? A hybrid system offers a potential solution. A universal coverage as a baseline, or the more private option for those who want, extended or more care, right? Right now, the conversation in America seems to always be about the battle between two extremes, right? Everything we're doing right now is so extreme. All right, we got to come back to the middle, have a good conversation about things. There's more than two ways to do things, right? So it doesn't have to be either a privatized system or a government-run system that replaces insurance altogether, right? But what if there's another way, all right? Like a hybrid system could take the best of both worlds, ensuring that everyone has access to essential care while still allowing innovation and choice through private insurance, right? So how would a hybrid system work? So at baseline, universal coverage would be there. At the foundation of the system would be guarantee that no American would go without basic healthcare coverage. The plan would include primary care visits, emergency treatment, preventive screenings and vaccinations, essential medications, maternity and pediatric care. And this would be funded, through a tax revenue system similar to how Medicare and Social Security operate right today. The goal would be to ensure that no one falls through the cracks. If you lose your job, you still have health insurance. You face financial hardships, you still have health insurance, right? You simply can't afford it right now, you still have health insurance, right? Your access to essential care will remain intact. So think of it as a safety net, not just for individuals, but for society as a whole, right? Preventative care, as we talked about, early treatment that lowers the long-term health cost for every American, right? It reduces the burden in the emergency room. It decreases the emergency room visits, right? It decreases hospital stay, leaving beds open for patients when they really need them. Our hospital beds are overrun currently, right? We're boarding, means we're keeping and watching patients in the emergency rooms when they should be, up in their hospital room, getting better continuity of care, right? Instead, they're stuck down in a busy, unsafe emergency room waiting to go up. Once again, that slows down uh, their recovery. I mean, that's probably a whole nother pod in itself, right? So, and this back to the hybrid care. So, for those who want more choice and faster service or specialized treatments, right, private insurance would still be available, right? This would cover your elective procedures, access to private hospitals, or faster specialist treatments. You could get luxury healthcare plans, right? And health insurance companies could still make lots of money, right? This model has already been proven successful in countries like Germany and Australia, right, where they have a public system and a private system. Right? In Germany, everyone contributes to statutory health care, right? Ensuring universal coverage. At the same time, some Germans take advantage and opt for the private insurance, which grants access to premium services. The overall result is lower overall healthcare spending and better outcomes, and definitely better outcomes than we're currently getting in the United States, right? The beauty of this approach is that it recognizes both the need for fairness and accessibility and the value of competition and choice, right? It's a win-win, right? It guarantees everybody has access to essential health care while preserving private sector competition to drive innovation and efficiency, right? It respects our American values, right? We value personal choice. This is a system that lets us choose more comprehensive or expedited care if we have the ability and we're willing to pay for it, right? By ensuring early, consistent care for everyone, we reduce the burden of expensive hospital visits and prevent people from delaying treatment due to cost, right? A hybrid system would reduce administrative costs from excessive insurance paperwork and claim denials, which could save hundreds of billions of dollars for Americans in healthcare, right? So instead of forcing a radical shift toward a single-payer model, or continuing with an expensive and inefficient privatized system, a hybrid system would work like this. All Americans would enroll in a universal baseline plan covering the essential healthcare needs that we've discussed. Employers could still offer private insurance as incentive to be, for their jobs, but employees wouldn't be forced to rely on their job for that coverage. Private insurance companies would have to compete, right, to offer premium services rather than just covering the basics, right? Potentially lowering costs and improving efficiency there too. Now they're going to be in a competition war to get more private insurance, more people to sign up for that private insurance, right? So that's going to drive down cost of this luxury insurance as well. Meanwhile, every American's covered under the Basic Insurance Act for the hybrid system. So it's not about eliminating private insurance. It's about ensuring that no American is left behind while still offering freedom of choice, right? I mean, then that's a win-win. It's a balance that could make healthcare more accessible, efficient, and affordable every day, right? A hybrid system gives us a path forward, a middle ground where no one's left behind, but we still get to have that choice. So let's take a look and see how a hybrid system might have played out for Sarah, right? In a system where universal coverage provided a baseline level of care, but private options are still available, Sarah's experience combined the best of both aspects. So at first sign of her illness this time, she booked a doctor's visit under the public healthcare system. No copays, no stress about cost. The doctor ran the basic test and prescribed antibiotics, just like in the universal system we talked about. But after a week, when her systems weren't improving, she had a choice. She could continue in the public system, where follow-up care was covered, but might take a few extra days to schedule, or for quicker use, she could use her private insurance to get in quicker for specialists, right? To get in quicker access, basically. So Sarah opted to use her private insurance, scheduling a same-day appointment with a specialist. She got her chest x-ray there and got stronger medication immediately. Because her private insurance focused on premium care rather than basic coverage, Her costs were reasonable. She paid a $30 copay instead of an $800 bill under her old catastrophic plan we saw when she had just, kind of that insurance that really wasn't insurance. She got the speed and flexibility of private care without the crushing financial burden, right? And the best part, she had chosen to stay in the public system, the universal side, she still would have received the care she needed. It just would have been a slightly longer wait time, right? But Sarah did well. She recovered without debt, without delays, and with choices that worked for her. So, we've talked about a lot, right? It's a lot of information. It's a lot of information to digest, and I hope we're giving you lots of stuff to think about. We explored multiple sides, the strengths of private healthcare and the benefits of a universal system, and we also got into what maybe a hybrid system might look like. At its core, healthcare should be about people. It's about ensuring that every single person, regardless of income or employment, has access to care they need to live healthy, right? That part really shouldn't be up for debate. But I also recognize the value of innovation and competition and choice, right? We shouldn't have to sacrifice those principles to achieve a universal coverage. That's why I believe a phased transition to a hybrid healthcare system could be the solution we need here in America. I mean, imagine a future where no one is uninsured, where basic healthcare is a guaranteed right, where individuals still have freedom to choose private insurance options if they want. Imagine a future where medical bankruptcies are a thing of the past, where small businesses, they're not burdened with skyrocketing premiums, and where preventative care, reduces long-term outcomes, right? We know that if you don't get that preventive care, it's not taking that away from you, right? This isn't about picking a side. It's about finding common ground, right? We can learn from other nations and adapt their successes. We can create a system that would uniquely work here in America. We don't have to reinvent the wheel. We can just make it better to work for us, to make it work for a majority of Americans, right? So, how do we balance fairness and choice in our healthcare system? What would a hybrid system look like, do you think? What do you think that'd look like? Do you think that's a system that could work or might be a good idea? Are we ready to put aside politics and work towards a solution that puts people first ahead of profits? Right? I don't have all the answers. I don't. I'll never claim to. I always have way more questions than I have answers. And I'll always listen before I'll speak. But I do know this. Healthcare is too important to continue to get wrong. It's time for us to think bigger and bolder and to find solutions that serve all Americans. Not just the wealthiest Americans, all Americans. Once again, I want to thank you for spending time with me here at Evergreen Perspective. I mean, healthcare is personal and it touches all our lives in one way or another. Whether you've had great experiences in the current system or have faced challenges or continue to face challenges. These conversations matter because they shape our future, right? Could a hybrid system be the right path forward? I hope we can get there. Let's keep the discussion going. As always, feel free to leave comments down below on the YouTube here, or slide over to Insta if you want to say something there. And if you enjoyed this podcast, please leave 5 stars and subscribe and share it. That's how we grow together. We get more voices involved. All right, I appreciate each one of you and want you to take care of yourself and take care of each other. Until next time, this has been Chrisley and this has been Evergreen Perspective, and I hope to see you all soon.